for your patience. All right, well, gosh, you guys, it is February 1st. That's just amazing. And so happy February 1st and welcome to the COVID-19 community update. All right, so just to give a brief overview of where we are with COVID community levels overall since we last met, the trends have been all good, coming down. New Mexico is mostly green, although on the Texas border, we do see what looks like a little hot spot happening there. Looking at community transmission, and again, these are just sort of two different ways of looking at how much COVID is around, but this also looks better than it has, although you can see there's still plenty of counties that have high COVID cases and high percent positivity. This is just looking at the cases by day or by week. And these are also trending downward, as you can see on the far right here, that green line keeps going down. I just looked at it 2 days ago and it's at 50 right now. So I think we're just kind of like bouncing up and down a little bit, but still at a much lower level than we have been. So this is the variant slide, and it looks a little bit different. The CDC changed the formatting. It's basically showing the same information, but what they wanted to make clear is that on the far right here, I don't know if you can see my cursor, the far right of the first box is really at a model or an estimate of where they see these variants, like how much of each variant there's going to be. And that is because the way they actually know which variants are around is through genetic sequencing, and that takes a long time. So we get, so we don't have kind of up-to-date information if we only look at the genetic sequencing. So kind of this first box here is what's real, and then these 3 bars on the right are the projection or the estimate. So having explained that, basically what's happening with the variants is that XBB 0.1.5, which we've been hearing about now for a number of weeks, is indeed taking over as the dominant variant. And it's kind of beating out the BQ1 and the BQ1.1. And this is sort of interesting. Each variant that comes along, we do say increased transmissibility. It does have the ability to kind of take over from other variants, but we're not seeing the same surges in hospitalizations and surges in deaths that, let's say, when Omicron first came on the scene back in, really this time last year. So we do keep seeing new variants. Our immune systems aren't, there's a question about like the vaccines that we got or past infection, are they going to protect us from the new variant? And overall, even though the vaccine wasn't designed to fight off XBB, but overall it's holding up pretty well. And we know that because, again, lots of people are getting COVID, but people are not getting hospitalized and dying at the same rate as, again, a year ago when we had a new variant on the scene. The other thing about XBB is it is also an Omicron baby, I guess. So like Omicron was kind of the mother variant, and then all these ones that we have seen in the last year all stem from that original Omicron. So it's not as different as, say, Delta was from Omicron. I'll just point out one additional variant that is being noted in the media and is at play in Europe is the CH.1.1. It kind of has this brownish color, and you can see it's just kind of been called out as its own variant here on the data tracker. And you'll hear the same thing about this one. It might be more transmissible, doesn't seem to be causing worse disease, and we're not sure if the vaccine will fight it off. And a lot of times when they do in-lab studies, it doesn't look like the vaccine's doing that good job. But when we look at how kind of in real life, what's happening, our immune systems are very complex, and somehow we're still able to fight off these variants. And again, not totally fight off, because people do get COVID even though they've had vaccine, but the vaccine still protects us from the worst outcomes. So some other big changes in COVID, the Navajo Nation did make some updates to its mask mandate, and in general, it lifted its mask mandate. They have been steady through the entire pandemic of keeping a mask mandate in place. They do have some exceptions to lifting the mask mandate, and that's early childhood education, primary and secondary schools, nursing homes, healthcare facilities, and of course, anyone who has COVID symptoms, test positive, or was exposed. So they continue to have a more conservative approach on the Navajo Nation than we do in New Mexico. So on vaccine updates from the FDA did, or the VRBPAC, it's a subcommittee of the FDA, met on last Thursday. And they recommended basically that we phase out the original COVID-19 vaccine and just use the bivalent for everything. Now, this doesn't actually go into effect until the ACIP meets and signs off on it, but that was their recommendation. And some of the reasons that they recommended this, one was just trying to simplify the process. As you all know who are working in this, it is very complicated, and there are tons of options, tons of different vaccine products out there. The other thing is that there is some data from, one of the big studies is from Moderna, who has really studied their bivalent vaccine that they used in Europe, which is slightly different than our bivalent, head to head with the original, and they used the bivalent as a primary series, and they got as good results. So we do have some data saying that it would work if we just switched over to the bivalent and stopped dealing with the original one. So hopefully that will go into effect soon. The FDA is also proposing some simplifications to the vaccine schedule. And in general, they're looking at trying to have it a yearly vaccine, although not everyone's convinced that it can be a yearly vaccine, because COVID hasn't really fallen into that pattern like flu, where you just see flu comes sometime between October and February, and then it's gone. So the idea is that people would get one COVID shot in the fall, and then maybe older adults or people with weakened immune systems and maybe young children would get 2 vaccines. But again, there's still a lot of debate on this, and it hasn't been finally decided. So moving on to testing for uninsured people. And really one other big piece of news is that the federal public health emergency is going to end on May 11th. And Biden declared that this week. I don't think anything is really going to change that. And with that comes really an end to a lot of the extra funding that helped us with provide free testing, free vaccine, and free treatments. So the federal government is no longer going to buy all the vaccine and then provide it free to the states. But for testing, we've already kind of been dealing with this. So you can still order free home tests from Project ACT. If you have Medicaid, those still should be free at a pharmacy. And then federally qualified health centers can test for COVID-19. They work on a sliding fee. And so that is probably the cheapest way if you need a PCR test and you are not, and you don't have insurance. But it is unfortunately kind of back to business as usual for the American healthcare system. So going on to treatments for uninsured people, Right now, again, all the Paxlovid was bought by the federal government. They provide it to the states for free. And so basically all the pharmacies and all the doctor's offices who have it at no cost, and then obviously provide it to patients at no cost. But that will change with the end of the federal public health emergency. So again, and even now, people do, while the medicine is free, people are paying for doctor's office visits. So again, FQHCs can help with that. And if people are having trouble finding treatment, whether they're insured or not, they can call the COVID hotline at 855-600-3453. And there is even, the Poison Control Center has some pharmacists that will prescribe Paxlovid for people who don't have a provider or are uninsured over the phone. So that's a good, hopefully we'll be able to keep that going. So COVID funding for uninsured, the federal government has not approved more COVID funding at this time. Once the funding runs out, the cost of COVID services will likely go up. The insurance will cover, but for people without insurance, it will be more difficult. And COVID vaccine will continue to be provided free at public health offices and will be free under the Vaccines for Children program. All right, so Liesl updated the wonderful COVID-19 toolkit, so that should be on the website. And again, a really good source of information. It's beautiful graphically and in nice, easy to understand language. This is the updated vaccine chart, and we probably are going to have to do another update in about a month when ACIP meets. So on the, and Liesl, were you going to talk about this, the weekly COVID-19 vaccine events?
Sure. I mean, I was just going to say that if you are looking for events that DOH is sponsoring, free COVID-19 vaccine events, we partner with the Facebook page to post them on the Facebook page. So just keep an eye out, and there should be flyers on there so you can use those whenever you need.
Cool. All right, so quickly on influenza or flu, overall things are looking much better across the country. Weirdly, New Mexico continues to be a relative hotspot of flu, although things are looking much better in New Mexico as well. But all season long, we've just been a little bit darker than the rest of the country. This is in that thicker yellow line. That's been the influenza-like illness curve in New Mexico. So you can see we're really on the downward trend, but it was a really bad year. And again, this takes into account all the things that kind of act like flu, RSV, COVID, anything that gives you a fever and then a cough or a sore throat. So you can see the national curve here in the thicker blue line, but anyway, things are looking better. For monkeypox, this continues to be good news. We haven't had a case in New Mexico in at least 6 weeks. Across the United States, the numbers are coming down, and that public health emergency was declared over as well. Okay, in future of this meeting, I'm going to hand this back over to Liesl. I can move the slides forward.
Okay, great. So as most of you know, CHWI has launched their new behavioral health initiative, and we were just discussing on our end how we might incorporate that into this meeting. We would still include COVID updates. We wouldn't let that fall, but we would just be incorporating new behavioral health topics as well. You can go to the next slide, Miranda. Oh, there you go. So basically what we want is your feedback on how you want this meeting to continue to run. What do we do well? What do you want to keep seeing? What do you need? What support do you need? What resources do you want? How would you like to see that incorporated? So please share your thoughts and ideas with us. We always have a feedback form on the CEU link, and we read those every week and we take it to heart. So yeah, that's really it. Thank you.
All right, and thanks to all of you for all you do. I'm going to stop sharing and hand it back to you guys.
The question is, will the change of removing primary vaccine and leaving the Omicron only comply with children's vaccines as well, or is this for adults only?
So great question, and a little bit remains to be seen. I think in general, the idea is for everyone to move over. What's interesting though is Pfizer, so what they're looking for is a 2-dose primary series for young children and immune compromised. And Pfizer is a 3-dose primary series, and it really doesn't hold up that well as a 2-dose series. It doesn't provide that much protection, or at least that was the data that the FDA looked at. So I think this is a lot of the negotiation, but I think the big picture is that is the direction they would like to go, is for everybody to use the Omicron type vaccine, or the bivalent type vaccine for all doses.
Great, thank you. Does anybody else have any questions for Dr. Miranda while she's here before we move on? Oh, here's another one. So if we got our last booster in early fall, we can expect to be able to request it again this coming fall?
So it looks like that will probably be the case. And so, yeah, as far as I could tell from the meeting, that looks like the direction that it probably will go. And it is a good point, because we've had people even asking us, like, why can't they get another booster now? So right now, that bivalent booster is only approved as 1 dose, but then more than likely in the fall, and whether it'll be the exact same one or whether, they'll tweak it a little bit. Pfizer says that they can get, if the FDA tells them what kind of variant they want to target, they can get a vaccine to market in 100 days with the mRNA technology. That is amazingly fast. So we'll see where that goes. I think in July, the FDA is going to meet again to kind of talk about, do they need to change up which variants are being targeted by the vaccine.
I have a question. So is the booster still effective with the new variants that are, like, is it still gonna protect people from the new variants?
Yeah, good question. So, and maybe next time I'll try and remember to bring, because there is, like, I think almost seeing the family tree of these variants makes you feel a little bit more confident that the vaccine could actually work, even though we're not seeing BA4 and BA5. But there was just a study done by the CDC where they actually looked at how effective the vaccine was against the XBB, that the kind of new variant that's taking over. And again, it's not perfect, but it works better in real life than it works in the test tube. So when people were first testing it in the lab, they're like, we're not getting really high neutralizing antibody levels, but people were actually fairly well protected, especially in the 3 months after the vaccine. And then, like we've seen with every booster, after 3 months, you start to get that fade of immunity. So yeah, it's not perfect, but it actually does hold up pretty well with these new variants.
Thank you.
Yeah.
I want to ask something. So if they were to remove the primaries and they would just leave the bivalent, would they have that vaccine as primaries, second dose, and boosters, or it would just be one?
So I think all good questions. What it sounded like is from now on, again, people would sort of get the pass on whatever doses they didn't get in the past, and we would just kind of like the flu. If you're an adult who's never gotten the flu shot, and 1 year you decide, I want to get the flu shot, you just start right there getting your 1 shot, and then next year you get 1 shot. And if you skip a year, you still get 1 shot the next year. I think that's the model they're looking at for most people for COVID. And again, maybe not for people with immune compromise and maybe not young children. You know, they may stay with a 2-dose, either 2 doses in a season or 2 doses the first season you get it. But for most people, I think what they're looking at is just that 1-dose model. And that would be the bivalent at this point.
Very good.
And I see the question about combining flu and COVID vaccine. Pfizer is working on a combined COVID flu mRNA vaccine. So yes, I think definitely there is talk about that. But whether it'll be ready by next fall, don't know. But that would be nice.
Great. Are there any other questions for Dr. Miranda?
I have a question. And can we say, Dr. Miranda, that we are in an endemic instead of the pandemic?
I think so. There's another interesting slide that kind of shows deaths by week. And so maybe I'll try and remember next time to bring it. But we are right now in the longest period of time. I mean, the deaths are still way higher than we want them, but the deaths have been running sort of 3,000 to 4,000 a week for weeks and weeks now. So the longest stretch where we haven't had a real bump in the death rate. So again, higher than we want them, but each of these new variants that comes and is causing more cases isn't necessarily resulting in a big surge in deaths. So I think that's kind of getting to the endemic. Yep, the variants come, the variants go, people get sick, but it, you know, between vaccination, people who have immunity from past illness and Paxlovid, we're weathering it. And I think we're all pretty clear it's not going to go away. So unfortunately, yeah. So I think you're right.
Yeah, I asked because, maybe sometimes the wording that we can tell the community that we still have the virus, but not to spread this state of panic that we live for 2 years.
Right. Yeah, and I think, you know, the other thing we still have is masks. So, and I think those will be with us. I mean, obviously the majority of people aren't wearing masks most of the time, but you know, if you're about to travel somewhere and you really don't want to get sick, like put that mask on for the 2 weeks before you travel, or, you know, whatever it is, grandma's birthday. So yeah, I think we will continue to use all those tools that we've used for the last 2 years. But like you said, hopefully in a more, like we understand a lot more, we have more tools. Hopefully it can be not a panic level.
Great comments, Fabiola. Thank you. Another question from the chat is, so does the bivalent only last 3 months?
So yeah, I probably misspoke a little on that because this study was looking at the bivalent booster and how well it protected people from XBB. And there isn't a whole long, it's not like we have a year of data on that. We probably have only about 3 months of data, but it especially offered protection even against getting XBB in the first 3 months after vaccine. So I think what we've seen, you know, we've had lots of boosters along the way, and we've had lots of variants that have cropped up. And the common pattern is you get a booster, you get pretty good protection even from getting COVID. It's not 100%, but you know, it protects you from getting COVID fairly well in those first 3 months. Then the immunity fades a little bit, but it still protects you. Your body still has protection against severe illness, hospitalization, and death. So you see more and more people getting COVID 3 months after they've had a booster, but they're not landing in the hospital at the same rate and not dying. And again, none of this is 100%, but that's kind of the pattern. You get really good protection at first, and then it kind of fades, but your body still remembers enough that it's gonna, protect you from those worse outcomes. And it's kind of like flu. It's why we get a flu shot every year, because, it doesn't last all season. So you get the flu shot at the beginning of the season and hope it lasts all the way to the end of the flu season.
All right. Hi, everyone. It's great to be here. So I'm Janice Gonzalez. I'm a pediatrician and the Chief Health Officer for the Early Childhood Education and Care Department. And then with me also is Colleen Lambert, who works with me at the department. And she's, I can never remember her correct title, sorry. Prevention, Health, and Wellness Director. There we go. I got it. All right.
Hi, everyone. Thanks for having us.
There she is. So this is a new department, very new, the newest of all the state departments. It was created by the legislature in 2019 and then opened in 2020, July 2020, and you all know what was happening then. In the middle of the early pandemic, we opened a new department. And it's exciting because we're only the 4th state to establish a cabinet level early childhood department that focuses just on this population. And the reason it was created was to bring together high quality programs and services that go from the prenatal period through age 5. This is the department's commitment to create a cohesive, equitable, and responsive prenatal to 5 early childhood system. We want to support families, strengthen communities, and of course, work on improving child health, development, and well-being. Okay, so one of the reasons that ECECD created my position and Colleen's position was because our secretary had a vision of integrating health with early childhood. We know that families are being served by both systems, the healthcare providers and early childhood providers, but those 2 systems don't always talk to each other. And so we wanted to try to see what we could do to bring those together better, because we know that children and families thrive when there is coordination between all these systems. That's what this diagram is showing: early childhood system, healthcare system, and the community. All of these are very important, and we want the child and family to be in the center, and then the 3 other systems interacting in a way that supports the child and the family to thrive. So that's our goal, and especially in our area of the department. So you might be wondering why we have prenatal to 5. And so I just want to go through this quickly a little bit about why we think it's important to serve starting prenatally and then up to 5. So our programs are designed to promote the parent-child relationship, and of course to promote the health of both the parents and the child, because we know that the child's health is very much related to the parent's health. And maternal deaths are really a big concern, both in New Mexico and in the United States as a whole. So every year in the US, about 700 women die from pregnancy complications. So that's one of the things that we want to work on. And also in New Mexico, a large part of the maternal deaths are related to substance use. So we have put a lot of time into working in that area as well: substance use in pregnancy and in the postpartum period. So this slide is showing drug use in pregnancy, and then when they're not pregnant. And so what it's showing is that for every age and every race and ethnicity, the drug use goes down when someone is pregnant. So they are highly motivated. We know that they're highly motivated to quit during this period. So we really want to be there to support them and help them to accomplish this, because if you just try to quit on your own because you discover you're pregnant, you know, that can also be very harmful. Withdrawal can be dangerous if it's not done in the right way. So, so we want to make sure that we connect people with services, you know, if they are in this time where they're highly motivated to get help for their substance use, we want to make sure that that we're there to help them and connect them with treatment and healthcare services, you know, so that they can do it in a way that is healthy for the mom and the baby. And this is another reason that we start early, because we know that most of the brain development happens in the first 2 years of life. So you can see these are pictures of the neurons in the brain and how they develop. And so, of course, it starts in the womb, and then it starts in the womb, and then the newborn. And then you can see by age 2, it's almost looking as much as developed as an adult brain, almost. So this is, you know, these first 2 years are just really critical. The support that we can provide to the family and to make sure that the child is healthy in those first 2 years makes a huge difference. And another reason we start prenatally is and focus on those earliest years is because we know that the experiences from those early years can impact the genes. It's called epigenetics, and it means that it impacts how the genes are expressed. So the gene itself may not change, but the expression of the genes can change based on what they're exposed to early on, and those impacts can be lifelong. So that's why it's really important to support families in those earliest years. And then again, because we started right in the middle of the of the first year of the pandemic, we saw a lot of the things that you all saw in terms of the effect on the parents and children, the impact on childcare providers. You know, we worked really hard to keep childcare centers open so that families could still have that. Of course, some of them did close, but most of them stayed open with a lot of extra support. We know that medical care and immunizations all went down because, you know, people didn't want to go out and go to the doctor and take their kids to the doctor. So we're still trying to recover from that. And one of the things that home visitors can do is to help track immunizations and talk to families about the need to get up to date on immunizations. And then, of course, just the stress and the mental health effects, has been a lot on both the staff and the families. So that's another thing that we've been working on. So the main programs that we're going to talk about are home visiting, family infant toddler program, and childcare. And what I really want to emphasize is that home visiting and FIT are completely free to families. And the recent changes that we've made in childcare assistance, which we'll talk about, make childcare free to most families in New Mexico based on income. So these are services that we just really want families to be aware of, because we don't want anybody, not knowing that they're eligible for something that they could get for free. So we're going to start with home visiting. Home visiting is where you have a home visitor who's trained in child development and in health and how to support families. And it's a relationship-based program. So they go out to the home repeatedly over time and build that relationship with the family. And it's for families who are pregnant or have children under age 5. It used to be only up to age 3, but now we can go up to 5. And again, it's free. It's available to anyone regardless of income. And there are telehealth options, although we are trying to get back to, more of the in-person services. During the pandemic, of course, there was a while where all the services switched to telemedicine, but now we're trying to get back to more in-person visits. It does depend on the family's comfort, though. It's still the choice of the family. So if they have someone at home who's at high risk for COVID and they really don't want someone coming into their home, we could still do the telehealth. So home visiting has been shown to have a lot of impacts on health, and it does improve health outcomes in several ways. It can increase breastfeeding rates and the duration of breastfeeding. It's been shown to decrease child maltreatment. It improves attachment between the parent and the child. It improves parenting skills. It increases the use of safe sleep practices, because these are all things that they educate the family on. And again, it can help make that connection with a healthcare provider if they need that if they don't have a pediatrician or a family practice doctor for their child, they can help them, find that connection. And we have several different models of home visiting. The current models that we offer are nurse-family partnership, which is nurses that go to the home. We also have a program called Families First that is also nurses that go out, and that is similar to home visiting. It's just an older model with a different name. And then we have parents as teachers. Some areas of the state, mostly the northern half of the state, has Firstborn, which is another home visiting model that was developed in New Mexico. And then Partners for a Healthy Baby and Nurturing Parenting. I think those are curriculums more than models, but those are used also. And then one of the things that we're working on right now that we hope to roll out in the next year is to add 3 new models: Family Connects, Child First, and Healthy Families America. And the reason we're doing that is because we want to make sure that we offer choices for families and different models that meet the needs of the different families in our state. We know that, not everybody has the same needs, not everybody wants the same kind of services. So what Family Connects will do, and this one just started up in Albuquerque, and again, we're hoping to, grow it statewide. But Family Connects is just a very short-term 3 visits right after birth. And then, so they go in, at that time, like right after birth, where everybody needs support. And then they can connect them with one of the other home visiting models if they want to continue having longer term home visiting. But it's designed to be just a short-term support for, for people who maybe don't really want a longer relationship, but we feel like everybody can use that support right after birth. And then Child First and Healthy Families America are on the other end. They're more intensive models that are designed for families that maybe have mental health issues, substance use issues. Maybe they've been in the child welfare system, with Child Protective Services. So it's a more clinically based and more intensive, more visits, kind of relationship with that one. So we just want to make sure that, that families can choose any of those models. And the ways that they can access home visiting, or that you can refer, there's 3 ways. So one way is if you know your local home visiting program, which some people do, you can just reach out directly to that program to enroll. If you don't know which programs are in your area, you can go to the newmexicokids.org site, and they'll have a list of all the home visiting programs by county, so you can see which ones are in your area and then call them. And if you don't want to do that, you can just call the 1-800 number where someone will help you connect with a program in your area. So those are the 3 ways. And then the next program is the Family Infant Toddler Program, which is also called Early Intervention. And this program is to support children with or at risk for developmental delays. So either they're already delayed in their development, or they just have some sort of condition that puts them at risk for a possible delay. So either way, the program can work with the family and support them. And so the goal is to really, you know, it's again, it's very parent intensive. It's very much, you know, working with the parent, not just coming in and doing therapy on the child, but working with the parent so that they can do everyday activities that help their child to grow in their development. And we have over 15,000 children served statewide every year in this program. So it's really serving a lot of kids. And there are 35 agencies, and every county in New Mexico has service from at least one agency. The goal of the program is to be accessible, respectful, family-oriented, and to provide services in the natural environment, which usually means in the home. So this again is a program where someone comes to the home. They can also do it at the agency, you know, in the early intervention agency, if that's the family's choice. But the idea is to, and they can also go into preschools and pre-K and work with kids there too, and childcare centers. But most often it's done in the home. So the referral process for this program is, again, you can either have someone call their local early intervention agency directly, and that's fine. You can make a referral, or someone can self-refer, you know, they can call themselves and say, I have a child that I want evaluated for this program. They can also call the statewide number. So again, we have this 877, it's a different number for this, but it's another 800 number that people can call and find out the resources in their area. And then if you call that number, then someone from the program will contact the family to set up an evaluation. So the first thing that they'll do is do an evaluation, talk to the family, evaluate the child, you know, see if they do meet eligibility for having a delay or being at risk for a delay. But you don't have to know that to refer them. You can just refer them, and then they'll do the evaluation and figure it out. And so again, on our website, which if we have time, I can show you the website. It's NMECECD.org. So New Mexico ECECD.org. And on there, there's all kinds of resources, and there is a list of all the family infant toddler providers by county, sort of the same as the home visiting link that I showed you earlier. So it's easy to find the ones in your area, and then it even has their website and their phone number. All right, and then the last thing I wanted to talk about is early education and care. That's also what people think of as childcare, but we know that childcare is more than just caring for the child, it's actually educating. So we like to call it early education and care. And this is a really cool new tool that we've only had on our website for a few months, and I want to make sure everybody knows about it. It's called the Child Care Finder. So you can again go to that NMECECD.org website, and you'll see right at the top, it'll say Child Care Finder. You click on that, and then it'll show you all the programs, the childcare programs, again by county, and a lot of information. You can drill down on the programs to see information like their hours, their quality rating, the ages of children that they take, what the tuition costs, languages they speak, all kinds of information on there. So it's a great way to find childcare if you know somebody who's looking for that. And then this is that new program that I talked about. This just started in last May. We had federal funding that we put into paying for the childcare subsidies, which used to be only for families that I think were making up to maybe $50,000 or so. And now it goes all the way up to $111,000 for a family of 4. is totally covered, totally free, no co-pays, nothing. So all they have to do is to go on the website and fill out an application. They have to be either working or going to school. And then, you know, show their proof of income, but it's a pretty simple application and pretty amazing. I think, you know, we're now the state that provides the most help with childcare, I'm pretty sure, of any state right now. And we are asking the legislature for funding to be able to continue this program. It was started with the federal COVID funding, but we do definitely have a commitment to continue this as long as the legislature approves it. So we hope that this program, you know, will be able to continue for many years to come. And this is again our website, and then we have a weekly newsletter if you want to sign up for that. So you can sign up for text, and then of course our 800 number for any of our programs. And we do have a flyer also that has all of our programs on a one-pager. Just really briefly what the program is and then the contact information. And I think Lisa was going to put that in the chat as well.
Yes, I just put the slides and the flyer and the website all in the chat. So feel free to download it. And thank you so much.
There we go. You're welcome.
Does anybody have, well, I know Walter, I think, has to leave, so I think Sarah's going to take over interpretation. But does anybody have any questions for Janice or Colleen about anything that you just learned?
Oh, I forgot to mention, we also have an advisory council, and we would love to have some CHWs on there. So if anybody's interested, let me know.
Great, thank you.
No questions. Maybe we should show the flyer. Can we pull that up?
Yeah, we can definitely show the flyer, and you can show the website if you want. Here, I can share it. Can you guys see this?
Yeah.
The flyer? Yeah. So do you want to talk about the flyer at all?
So this has even more programs. This has really all the different programs that the department offers. I didn't touch on all of them because I didn't think we had time, but it includes the home visiting, the FIT program, childcare, Families First, which I mentioned, which is a nurse case management program. It's similar to home visiting. And then pre-K, Food and Nutrition Bureau, they provide food in childcare and pre-K settings. And also the summer food program is part of that. We don't directly oversee Head Start, but we have a Head Start collaboration office that works with the Head Start centers in the state. And then the Child Care Finder is on there as well. And then, so one side is English and one side is Spanish. Yeah.
Great.
Oh, I see a question. What support do you have for women that are breastfeeding when they return to work? So mostly what we can do is connect them with other resources. I know WIC has breast pumps that they give out, and they also have breastfeeding peer counselors that they can connect people with. So what we would do is the home visitor or nurse they could also try to, you know, provide support directly, but then they could connect them with WIC so that they could get a breast pump or whatever other resources they need. So we do a lot of connecting. Oh, my email, yes, I'll put it in here.
I have a question. I scroll a little bit in the page and see some of the providers for children care. They don't accept the child care assistance. Is any answer about why, or
I don't know why, but I could try to find out. What's the name of it?
is a few of them like the Hive, because that is in Sunland Park. The Hive, let me tell you some of them. I click in 3 of them, and the 3 of them are not accepting childcare assistance. One of them is the Hive Education, and the other one I saw is the NMDOH Daycare and Anna's Learning Center. I know if it's something with the page or they really don't accept that. And
Yeah.
everyone I'm clicking, they don't accept. So I don't know if something regarding the web page or the specific center.
All the ones in Sunland Park that you're looking at, they don't accept it?
Some of them, yes. Right now, everyone that I'm clicking, it says child care assistant not accepted. All of them is in different ones that I click.
That's interesting. Thank you for finding that. I will have to find out and get back to you. I hope it's
Okay.
just a problem with the website and not that they really don't.
Hopefully, yeah.
Yeah, I don't know why they wouldn't.
Okay. Yeah.
Okay. I'll ask our child care director and get back to Lisa so she can get back to you.
Yeah, thank you, Fabiola.
Yeah, because over here in the southern Doñana, and I guess every part in the state, there is a lot of people that they cannot afford the prices that the
Yes.
care system charge. So that's why I was looking for specifically for that. So thank
And
you.
that's what we heard over and over, that people just could not afford childcare. It had become unaffordable for most people. So that's why this was one of the initiatives that was really important to our secretary.
Thank you. Maureen, do you want to ask your question or comment?
Yes, thanks. Yeah, I too, I was trying to look for the FIT agency for our county. And I was trying to look for that item that you shared on the website of how to find what that is in our county. And I just couldn't find it. I found the FIT page, but I don't find where you search for
Oh, okay.
the agency. I don't know if you can share that again and show us the link. Sorry.
Let's see if I can.
Yeah,
How-
maybe you
How
could
would I share the
share?
website? The website.
Yeah, go to your screen share, click the screen share, and then you should be able to select your browser. There you go.
That work?
Yes.
Okay. So you can either go to either of these links, but let's just go to parents for now. So click on information for parents, and then all the programs are listed here on the left. So you would go to Family Infant Toddler Program, and then FIT referrals, I believe. Let's see if that worked.
Janice, if you go back to the last page you were on and just scroll up a little bit, there's you can see.
There we go. I knew it was there somewhere. FIT provider list. Okay. So what we did was we clicked at the top for parents, then the program on the side, family infant toddler, and then right here, thank you, Colleen. Please see the FIT provider list for a list of provider agencies. So you just click there.
Oh, thank you. Yeah, I hadn't gotten that far. I did the same thing you did to the referrals, and I was like,
Yeah, there's
per
so
county.
much information on
Okay.
here. The website can be overwhelming.
Okay, thank you.
But then you open this file and this is what I had showed. Yeah, this is the one that I had showed. So this is where you can just go. All the counties are alphabetical.
Yeah, for instance, I'm in Otero County. I'm thinking it's going to be Zia Therapy Center.
Let's see.
Yeah.
Yeah. Well, yeah,
Okay.
Escalero Apache and Zeotherapy Center.
Okay, great. Thank you.
Janice, maybe you could put that link, copy that link and put it in the chat. The link that you're on.
This one that we're on now?
Yeah, just so it's direct. That'd be great.
And updating my search, there is a filter that you can find everybody, every center that has that accept the child care assistant, but the rest of them don't. They don't accept it in the web page. Okay, in the link. Just for you to know.
I'm glad you pointed that out because I really didn't realize, that was an issue. I'll definitely talk to our child care director and see why that's happening and what we can do about it.
I have a question. If a child has not been followed by, say, the special needs, I work with special needs people and children a lot. Can you still get them enrolled to be evaluated?
Yes, up to age 3, they can be evaluated by the FIT program. So it goes from birth to 3. And then after that, they would be evaluated by the public schools,
Okay.
starting with age 4.
Can I just chime in? I used to be a home visitor, so I'm super excited that you guys are talking about it. So I'm yay! But to answer Ife's question, you can get your child evaluated if there is a question about a disability, and you can go through the CDD. They do have a FIT program there, and then they also have where they can evaluate children all the way up toward past 18. So
CCD?
It's the CDD, the UNM Center for Development and Disability.
Okay.
I used to work there. That's why I know. So sorry, I didn't mean to derail everybody, but
Oh no, that's great. If you could maybe send me whatever you have as far as phone numbers or whatever of a particular child. And I don't know that their needs are being met because they were on the Navajo reservation, but they were removed from the parents, and now the grandparents are trying to take up the slack, and they're placed with them, and it's a little daunting. So yes, if you could send me.
If you could put me your email in the chat, I can send you some info.
I will. Thank you very much.
Sure.
Great. We'd love to see you guys sharing resources. Please feel free to speak up, share your knowledge, share your resources, give feedback. Rosalba?
One of the things that because of talking about child development and the bond between the mother and the baby, and how daycare is so expensive, and really or the grandparents taking care of the babies. One of the things that I would really like to work on, and I hope you agree, is that there's some instances where there's certain jobs where the mothers can take, if it would be good if not just to express milk, but actually take the babies to work. Because before 6 months or 3 months, the child, what does it do? It sleeps, it eats, it poops, and it sleeps. So, if he's with a mother, the baby will be very quiet in their little carrying case, no? So I'm thinking, why can't we take the babies to work? I mean, they would go back into the workforce, they would have more income for their family. They would, the baby, even if they're, and of course, not all the settings, but the majority of the settings, that where the mother can be, that the babies could be. So I'm thinking that who made all the rules? Probably men. So why can't we take the babies to work? So that's something that I would like to work on. And I was just thinking, what do you think about that? Just wondering.
Yes, I agree. I think that that's a wonderful idea. I was just trying to find, I know there's something called Family Friendly New Mexico where they give businesses awards as being family friendly if they do things like that, like what people bring their babies to work. I couldn't find it quickly enough, but I totally agree with you. There aren't enough of those businesses. I think that's something that we all need to push for, you know, maybe with our legislators or yeah, however we can. I think you're right. Like those are rules that we need to try to change.
So if we start something, would you support us?
Me personally, yes. I can't speak for the department.
But now we can get the word to home. I think that will be a lot easier to get the word to home because there is a lot of remote working now.
That's another thing, right? We need to keep that option of more remote work for people, especially when they have a baby. There's also a paid family medical leave bill that's being heard in the legislature. And so that's another thing that it would be great for people to advocate for, just to make sure that everybody has that opportunity for paid leave after they have a child.
Hello, I want to add something to the, just want to add my opinion to this.
Yeah.
So I totally agree that that would be a great idea to take a baby to work, definitely depending on the work setting. I did used to work at a domestic violence shelter, which was unsafe. So it would be like very unsafe to take a baby, especially because we would deal with a lot of violent partners that might be in the look for their wives who we are helping, and just for safety reasons, it wouldn't be safe to have the baby there. But I agree that if you're in a safe environment and maybe in an office setting where the baby could be there, that's great. But I do see the barriers that would probably happen or exist when it comes to bringing a baby to work. But definitely we do have like those other options, like maternity leave or being working from home. I feel like working from home is much a better option. Being allowed, if you have a breastfed baby, being allowed to stay at home and work from home sounds like a much better option than the baby having to be in that environment for so many hours.
That's a great point, right? Not every job is safe to bring a baby. I mean, obviously the best is paid leave because we want parents to be able to just be home and just focus on bonding with the baby and not have to work at all for the first few weeks. So I think that's critical. And then, you know, if they could work from home for a while after that, that would be ideal. But yeah, there probably are some office settings where it would work.
And I don't know, Janice, if you want to talk more about having CHWs on your advisory group or what that would look like.
Sure. So as I said, Colleen and I, we have a grant that the focus of it is to work on integrating health and early childhood. So obviously community health workers would fit with that. And we have meetings about every 2 or 3 months for a couple hours. And we just, you know, we asked for the advisory council to help us with all kinds of things like what data we should be looking at, you know, what they're seeing in their community that we need to work on, all kinds of things like that. Colleen actually leads it, so she might want to add something, but we do try to have, you know, a wide representation of people on the council so that we can hear from all kinds of different voices, both in terms of different professions and different areas of the state and different races and ethnicities and all kinds of populations. So I think that, yeah, it would be great. I think one person did say that they were interested. Oh, now there's another one. Good. So that would be great.
Yeah, I'll get everybody's email address. Our next meeting is actually going to be March 30th at 9 a.m. So I'll be sending anybody that's interested additional information on how to join. Thanks.
Well, thank you both so much for coming and spending the time to be with us and to give us all this great information.
Thank you for having us. If you have any other problems with the website or questions that come up, just feel free to email me. I put it in the chat and Lisa can always contact me too. Thanks, everyone.